Welcome to the annual safety training for volunteer services at the Hospital of the University of Pennsylvania. This training will cover infection prevention, emergency management, HIPAA, safety net, and cultural diversity. By understanding the material in this training, you will contribute to a safer work environment for you, staff, and most importantly, the patients. You will help improve patient outcomes through best practices. As a member of the team of the Hospital of the University of Pennsylvania, you are subject to periodic reviews and interviews by government regulatory agencies. These modules will help provide you the necessary information and knowledge to confidently respond to surveyor questions and, of course, keep everyone at the hospital safe and provide a better service experience. Let's begin. Infection prevention is everyone's responsibility. You will be volunteering in a hospital environment where sick, often contagious people or people with compromised immune systems are present. To keep patients, yourself, and even people outside the hospital safe, it is important that you follow the infection control practices. The first thing to know is that you should treat all blood and bodily fluids encountered in the hospital as infected. If you come into contact with any blood or body fluid, report the exposure immediately to staff. This is what we call our standard precaution. In the event you are exposed to blood or body fluids, you may be treated by the hospital to prevent further exposure or infection. Regardless of where you volunteer, washing your hands frequently is the best way to reduce the spread of infectious disease. Our most important role is to sanitize your hands when you enter and exit a room. Gel or foam dispensers are posted near every patient room door throughout the entire hospital. Use them frequently. Even if you are not entering or exiting a patient room, you do not know who has touched that handrail, doorknob, or elevator button before you. Remember, you must wash in and wash out of patient rooms. Before entering a patient room, determine if there are any precautions you need to take before entering. Often, the precautions are not for you, but rather for the patient, who may have a weakened immune system. Read all signage outside of the patient door before entering. The signs will provide written instructions and pictures detailing which steps are necessary to take to properly and safely enter the room. There are 4 types of isolation precautions. The red signs mean contact precaution. This sign will instruct you to wash your hands prior to putting on gloves and gown before entering the room. The blue signs mean airborne precautions. In addition to the usual hand hygiene practices of washing in and out, people who enter these rooms are required to wear a respirator. The hospital will not provide a respirator to volunteers, therefore, volunteers may not enter the rooms marked with airborne precautions. The green signs indicate droplet precautions. Droplet precautions are in place for infections that are transported by fluids, such as influenza. Visitors to these rooms must wear a mask provided on the equipment cart outside of the rooms. Brown signs mean special precautions. Rooms requiring special precautions require gloves, gowns, and washing with soap and water after exiting the room and removing your gloves and gown.